So in this video, we are going to work on reestablishing the proper S-curve in your spine to take pressure off your lower back. So if you're having lower back symptoms and in your self-assessment you noticed that there wasn't an S-curve in your spine, so that being a cervical curve, a thoracic curve, and then a lumbar curve, then this is the sequence for you. So we are going to start with sitting knee pillow squeezes. So you want your feet at 90 degrees here on a block. We're going to take this yoga block long ways, so it's a little bit wider than short ways. Stick it in between your knees. I want you to roll your pelvis forward here, palms up on your thighs, and we're going to squeeze and release that block. Squeeze, release. So we're getting that nice S-curve in our spine here. Pelvis is rolled forward, so we're strengthening the muscles around the pelvis. Oftentimes the back starts to hurt because the hip flexors aren't functioning properly, and the back ends up taking over for the work of the hips. And so here we are wanting to reestablish that work in the pelvis while still getting an S-curve in our spine. So just take a little break for a second. Note if you're feeling it different, right versus left, and we're going to restart again. So I like to take those little breaks so you can feel if you're imbalanced, and then when you come back into it, you want to be a little bit more balanced. So you're really focusing on squeezing equally here. So squeeze, release, squeeze, release. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Take another little break. If you're feeling really uneven, go ahead and stand up. Just take a little lap around the room. Come back down. We're going to do one last set of 20. So 20, 19, 18, 17, 16, 15. Still pulling equally here. I want you to keep getting that release. So don't just squeeze, 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 because then your muscle doesn't fully relax and engage. And that's what we want. Let's go. 5, 4, 3, 2, 1. Very nice. So we're actually going to do the exact same squeezes, but changing the position of our pelvis. So we're gonna go ahead and get in static back here. Your legs up on the block, but all the way to the block, so you're making this 90 degree. Note that difference in your pelvis. So before we were trying to get that lumbar extension, now we're just getting a neutral pelvis, but our hip flexors and all of these muscles in our legs should be able to act just like they were when we were sitting. Although you'd be surprised how many people feel like this is completely different just because their pelvic position has changed. All right, so squeeze, release, squeeze, release, squeeze, release. Make sure your back stays relaxed, stomach stays relaxed, so we're not rocking our pelvis here to try to make this work happen. Everything basically from the bony bits of your pelvis up are staying completely relaxed in the ground. Some of you might feel like this is harder because we just took the muscles of your lower back out of this work, and now your legs are like, oh my gosh, I actually have to do all of the work here. I'm not used to that. Well, we're gonna make them used to that. All right, take a little break. I'm going to count on this next one. Let's go ahead and start. So 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, pulling equally, 8, 7, relaxed stomach, 6, 5, 4, 3, 2, 1. Good. Take another little break. We still have one more set to go. Are those inner thighs on fire? You'd be surprised how much just doing this simple movement, it's going to take a lot of pressure out of your lower back
because we're really working on strengthening that pelvis. All right, let's go. Last set here. Squeeze, release, squeeze, release. And again, really feel like you're fully releasing. Obviously you can't because the block will fall, and I've actually had clients drop the block on their stomach, but I want you to get that experience of relaxing as much as you can and not just holding that squeeze. That's going to do something different and not really what we're after. Are you feeling it more on one side than another? Maybe it kind of changes. And it might feel different depending on the day that you do it. All right, let's go. 5, 4, 3, nice shake. 2, 1, and relax. Excellent job there.
All right, guys, we have another exercise to help reestablish the S curve in our spine. And for this one, we just get to relax into it. So that's awesome. All right, we're gonna start actually with 2 yoga blocks. So hopefully you have 2. If not, you can use 2 big cushy pillows, because we're gonna elevate our arms up. So you're gonna make this kind of goalpost cactus arm position, goal, you know? And then we're gonna lay our forearms on top of these blocks. Now I have them at their very highest. If you have a really, really tight upper back, then you can have them at a lower level, all right? So we're gonna lay down on our stomach, bring our arms out into this cactus arm position, relax our hands down. You're gonna bring your toes together, let your heels drop out, so you're getting a slight internal rotation of your legs, and then you're gonna place your forehead on the ground here. Now, if that's a little bit uncomfortable, you can roll up a towel and place it on your forehead so your nose isn't squishing into the ground. But if you just place your forehead there, then you shouldn't have many issues on your nose being squished. So we're actually going to relax here in this position for 6 minutes. So you're really focusing on letting your spine just melt into the ground. So I'm going to go ahead and start that. But then I'm also going to show you just how it looks from the front view. Now you can't see my legs on here, but I want you to just see that arm position just like this. So sometimes if you have a really big back disparity or shoulder disparity, one side is going to be raised a lot higher than another. And as we melt into the ground and relax our body, that will start to level out. All right, I'm going to go ahead and do this with you guys. And I'll mainly be quiet throughout this. I want you again to focus on your breathing, relaxing your butt, relaxing everything. Just let gravity pull your spine back into the ground to that proper S curve. I want you to notice if you can feel an expansion in your low back at the bottom of your ribs, but on your back. Try to breathe into that area. Good. Just do a full body scan, paying attention to where you're holding tension. Try to relax in that area, bring your energy there, and just let it go. Really focusing on expanding that lower rib cage. A lot of you probably haven't breathed into your back very much before. This is a good opportunity to practice that.
Are you feeling like your lower back is starting to let go? Are you feeling like your mid back, upper back, arms are letting go? Just keep melting into the floor. Let gravity do its job. Let's take advantage of gravity here today. Good. Still focusing on expanding that back when you breathe. So not lifting your shoulders, but feel your stomach kind of press into the floor and feel your back rise up to the ceiling when you inhale, and then let it all go, relaxing, melting more into the ground as you let it go. Doing another full body scan. Notice where you're holding any tension. Try to let that go. Are you feeling like your pelvis, the bony bits on the front of your pelvis are starting to relax even more into the ground now? We're starting to get some extension through our hips and our legs. Good. Now as we come to the end of this exercise, if you feel like there's still tension in certain areas of your body that haven't fully let go, especially if you're feeling different in your arms, both right to left, I would suggest staying in this position for a little bit longer, pausing the video, and then when you're ready, you can come out of it. We're all going to have little carpet patches on our forehead, but at least we'll have them together. Alright guys, so now that we brought that proper S-curve back in a relaxing way, we get to solidify it with a strengthening way. So we're going to do our static extension, and I will give a modification of this at the end. So if this looks like crazy scary to you, then just fast forward a little bit and so I can give you the modification with your knees on the ground. So we're going to start with our knees on a block. Alright, you might not use a big cushy block like I do. You might actually use a sturdier chair. You're going to walk your hands down onto the ground. You can see my wrists are directly under my shoulders here. My knees are directly over my hips. Now I'm going to walk my hand one hand's length forward, shift my shoulder weight over my wrists. I'm going to relax my stomach down, sticking my tailbone up into the sky. Relax my shoulder blades, pinching them together, keeping my elbows straight, and then relaxing my head. So I'm going to go ahead and start the timer. We're going to do it for 1 minute today. But you can work your way up to 3 minutes here. Right? So really feeling your shoulder blades squeezing together. You can feel that S curve that we just got on that last one, that modified floor block. Now we're really strengthening it. We're loading it here. You might start to feel this a little bit more in your hip flexors. They really have to turn on here. So breathe through. And like I said, if this is scary to you, then I will give you the modification afterwards. Good. Making sure that your hips are still forward of your knees. Now they're not directly above your knees. That's how we're going to get that hip flexor engagement. We got almost 10 more seconds.
Really let those shoulder blades come together, keeping those elbows straight. There we go. You're going to walk your hands in, and then you can walk them up onto the block.
So like I said, you can do that one for a minute, or you can work your way up to 2 or 3 minutes, depending on your comfort level. So for those of you who are like, no, I'm not going to do that, I'm going to give you the modification, a little slightly easier version. So this one you're going to start on hands and knees. Let me tuck this in so you guys can see my pelvis. All right. Now we're going to walk the hand one hand length forward. You're going to shift your weight over. Still shoulders over wrists, but now your hips are slightly in front of your knees. Relax your pelvis, tilt your tailbone up into the sky, shoulder blades come together, head drops. And this one we're gonna hold for a minute to 2 minutes as well. So slightly easier, slightly less loaded on your wrists and your shoulders. So you can work your way up to the block one. You will feel your hip flexors a little bit more on the one with the block, but you have time. We'll get there if you're not comfortable with it yet. So our final exercise for this sequence is our beloved air bench. So if you haven't done an air bench before, here we go. You're gonna prop yourself up against a wall. You're gonna walk your feet out. They're straight, parallel, hip width. Right, you're gonna sink down, so bending your knees into almost a wall sit. Now here's the difference between air bench and a regular wall sit. I want you to press your lower back into the wall, so we're kind of doing this little tuck here. Now I don't tuck very often, but for this one I do want you a little bit tucked. So if I was there with you, I would slide my hands behind your back and it wouldn't budge. There's no space, it's completely flush against the wall. Now, you want to be able to see your toes, so you're not at a 90-degree angle, you're a little bit wider, your knees aren't directly over your ankles, they're a little bit further behind. Now if you can sit down further, that's awesome, go ahead and do that. Now I've been filming a little bit today, so I've done this a couple times, so I may come up a little bit more on the wall, but please feel free to bring your upper leg parallel to the ground. Keep pressing that back. And I would much rather you get lower and spend less time in this than get higher and spend more time. Okay, so challenge yourself. Now, if this bothers anybody's knees out there, you can raise yourself up on the wall a little bit, all right? Do what feels good for you. Remember, we're not no pain, no gain. So if it's painful, then come out of it. But normally, even if people have, I've had clients who are going for complete knee replacements that can do this for like 3 minutes. So even if you have knee issues, you still might be able to do this exercise. So that was a minute. You can work your way up to 2 minutes. My quads are burning, so we're gonna go ahead and come off of it, push your way off. So that was our sequence to help realign the lower back and bring the proper S-curve back into your spine and engage the hips so you don't suffer from lower back pain anymore. So I'll see you guys in the next video. Hope this helped you.